Intertrochanteric fractures, or the fractures in the hip region, is an increasing epidemic of longevity. So when people survive longer than 70 years, the bones tend to become softer. Now, what is the additional problem that has come up is the kind of work that we are doing. Most of them have moved away from agriculture and hard work and gone towards office-related works. The strength of the upper limb and lower limb starts reducing. And postmenopausal, if the lifespan is around 15 years, these kind of fractures, which are called as osteoporotic fractures, come. And if a fracture comes in the hip region, then these fractures are called as the trochanteric fractures. Every woman who has reached postmenopausal stage should undergo a DEXA scan. And those who are having poor bone density should put themselves on appropriate medications. And on top of that should be put on strengthening programs and fall prevention trainings. In spite of all these, if they fall down, and sometimes they break and then fall down, these fractures should be treated immediately. A lot of problems that we face with the attenders is because when somebody is 70 years, they get a fracture, they are not walking much, they are only in the house, they delay the further treatment. The treatment of a trochanteric fracture is surgical. That post-fixation patient need not be bed rested for 3 months, 2 months and all, but they can be made to stand and walk and turn, thus preventing further deterioration. And of the quality of life in the form of getting bed sores. And all these things do not come. So trochanteric fracture, remember osteoporosis, that is the reason for getting it and should be treated as early as possible, so as to get the people getting back to life early. Thank you.